What's the meaning of miscellaneous? It means different types of fungi. Put in your mind, we have different types of pathogenic fungi, but we have no enough time to restrict them and to give you all information about each of it, of which. Therefore, I try to collect them, the rests, which are the most important fungi in our life, and it's considered to be pathogenic, prominent pathogenic ones. Therefore, I collect them in one lecture, which is entitled Miscellaneous Fungi. The first slide represented the first type of fungi, which is a common one, referred to as Malassezia species. Malassezia is a very common disease. You will saw it in future if by Almighty Allah volition. You will see this type of disease. Malassezia, of course, when I said Malassezia species, it means species, genus, and its species. I mean the name of the pathogenic disease. Sorry, pathogenic fungi. But what are the names, synonyms of the disease, which is the most common one? Tinea versicolor. It is so common one in dermatology. Tinea versicolor, or it's also referred to as Pityriasis versicolor or Tinea flava. Of course, this is the definition if you remember. What is Malassezia? Of course, we have different types of Malassezia, starting with Malassezia furfur. Furfur is the most common species among the others. We have different types of species, but the most common one is Malassezia furfur, which is a lipophilic yeast-like fungi. It's very important information. It is lipophilic. It's prefer lipid, okay? That it's considered to be a member, sorry, of the normal flora of human skin, and particularly those who have oily skin. Proliferation of the agent mainly occurred in the stratum corneum, which is, of course, causes the disease pityriasis versicolor. Okay, pityriasis, I forget I between P and T. Okay, there's a mistake here. The disease characterized by forming what? White to brown, sometimes fawn. It means fawn يعني faint, فاتح. Fawn colored, discrete, or sometimes confluent lesions, which is covered the skin with, which is in turn covered with thin scales. This is definition of Malassezia or Tinea pityriasis versicolor. Of course, the fungi is cause what is called catheter-acquired fungemia. This is very important phenomenon. That means it's responsible of two types of diseases: superficial symptoms and systemic symptoms. Superficial because it's normally found, low hygienic conditions, oily skin, all of these factors predisposing for flourishing the growth of this agent. But when the disease develops systemically, how? By catheterization, and particularly in those adults or neonates, malnourished neonates who are receiving IV lipids. طبعا this fact IV lipids not available here. طبعا not used in Iraq as a regimen of treatment, but maybe some days used. Okay, malnourished neonates or adults. Such patients develop emboli, particularly in the lung or other organs. This picture reveals, I don't know if there is anybody here or not. Do you hear me, please? Students? Nobody here. Anyhow, okay. These lesions, okay, these lesions represented the pityriasis versicolor. Later on, of course, you know by knowing the clinical manifestations, what is the appearance of these lesions. Sorry. Starting with the clinical manifestations, the disease usually as asymptomatic, mainly asymptomatic. That means not painful, not itchy. Patches which appears either as hypo or hyperpigmented macules, large spots. Okay, hypo or hyperpigmented macules, which is also varying in size, shape, and color from patient to patient, even in the same patient. The most common size that the disease develops are chest, upper back, shoulders, upper arms, or abdomen. This picture you can see here. This is a back and upper shoulder. So patient suffering from this type is hypo, not hyper. Hyper dark, hypo faint. This is hypopigmentation due to tinea. Sorry, due to the Malassezia species. Okay, which is the disease as we mentioned previously, referred to as Piedriasis versicolor. This is another type of lesion, hypopigmentation on face of a young child. This type is hyperpigmentation. This is hyper, not hypo. Of course, put in your mind the hypo and hyper may depend on the color of the skin, maybe racial factor. I mean, maybe depend on the seasonal also changes. In summer, maybe hyper due to the sun effect, sunrise. Okay, or maybe a hypo in winter. Maybe many factors play a role in developing these types of different colors or pigmentation of these lesions. Sometimes the lesion may be not restricted on the face, on the shoulders, upper back, whatever, but it's maybe extend to the thigh, to the neck, sometimes forearm also. But there is a type of uncommon folliculitis. Uncommon folliculitis may be occur. That means the hair follicle may be infected by the agent causing folliculitis with erythematous papules, of course, which the sometimes papulopustular lesions, which is resemble acne. Sometimes it's confused with acne, but when the clinician asks the patient, do you have antibiotic long course of steroid, whatever, he should conclude that the patient suffering from pityriasis versicolor rather than acne. Such patients are often receiving antibiotic or steroids, as mentioned previously. The most common species, as mentioned above, Malassezia furfur, which is increasingly recognized as a cause of catheter-acquired sepsis, as the previous slide show or presents or display this fact. Patients who receive IV lipids for long periods of time, low hygienic condition, because it's normally found in the skin. The catheter may be contaminated with the Malassezia species, and because it's lipophilic, and the substance used for the treatment is lipid, the microorganism can be mixed with the lipid and from the site of intrusion of the catheter, causing sepsis. The clinical signs may be absent, or the patient may be febrile only. This agent also, this is very important phenomena. This agent, I mean Malassezia species, is responsible for dandruff. Dandruff اللي هي القشرة. اللي عنده قشرة, that means he suffering from fungal infection, mainly caused by Malassezia species. This picture reveals the Malassezia. Okay, this is Malassezia furfur, not the other species. The characteristic feature, of course, in the practical session, you will see the details of each agent, but the most common, as I mentioned, Malassezia furfur. The characteristic feature of Malassezia furfur, of course, is form hyphae and spores. Hyphae and spores. You can see these hyphae, these spores. The characteristic feature, it's look like balls of meat with a spaghetti. This is characteristic feature. This is funny description, but it is look like meat of ball. Ball of meat and spaghetti. This is another type, maybe Optosa or Pachydermatous, what I don't know. We have different types of species, of course. This is another type of or species of Malassezia. Okay, we covered the important information of Malassezia. We turn to other disease, which is referred to as Piedra. Piedra, which is also referred to as, I mean, the synonym of the disease. Put in your mind that the synonyms that I just chose for you, this is requested from you in the examination. Maybe I'm not mentioned the frank name. For example, when I have a question, MCQ, whatever, I don't say Piedra. I said maybe Pidgeot's disease or maybe Tinea nodosa. Okay, you should know these synonyms, very important, because it's just I chose only these common names. Okay, what is Piedra? Piedra is mean infection, which is mainly limited to the hair shafts, and it's characterized hair shafts mainly, and it's characterized by forming firm, irregular. This is the definition of the disease. Okay, the hair shaft infected by the Piedra. Piedra mainly forming firm, irregular nodules composed of what? These nodules, and these nodules attached to the hair shaft. Okay, and these nodules consist of the fungal elements. Okay, we have two types of Piedra, black Piedra and white Piedra, okay, according to the causative agent, but the causative agent of each of which separated from each other, not related with each other. Black Piedra is caused by Piedra hortae, which is involved within the class, of course, in the classification of any microorganism, any organisms. It's have phylum, kingdom, phylum. I forget the, of course, these. I think you have it in the first stage in the college, in our college. Kingdom, phylum, class, order, whatever. I think this is the class as Ascomycetes. The Piedra hortae belongs Ascomycetes. A white Piedra caused by another species or genus referred to as Trichosporum bigili. Therefore, the name of the disease, Bigilis, is the name of the clinician who characterized this phenomenon. Trichosporum bigili, which is belong Basidiomycetes class. Okay. We should know the clinical manifestations of each of which, of course, starting with the black Piedra. Black Piedra usually found, as I mentioned, on the scalp hair, and the infected hair, usually the scalp appears normal, but it seems to be rough, sometimes sandy or granular in touch. Therefore, we cannot see these nodules by naked eyes, but when we touch the hair, the infected hair shaft, we found it sandy or tough in touch or rough. The infection is mainly asymptomatic, not itching, painless, with a nodular just infection of the hair, which is these nodules different in size, okay, and characterized by attaching firmly to the hair. These nodules attaching firmly to the hair shaft. You cannot pull easily these nodules from the infected hair shaft. The shape of these size usually is thick, usually in one end, and tapered يعني مدببة at the other or full opposite side, just look like the triangular shape. Okay, مثلثا. Thickens. This is of course there we have atypical shape, but this is the typical nodule. Thick from in the or irregular in one end and tapered at the opposite end. The causative agent, as I mentioned previously, is Piedra hortae, which have no ability to penetrate the cortex of the hair shaft. This is of course, this is hair shaft infected with the nodule of black Piedra. Why it's appear faint? Because it's dealt with in diagnosis. We can use KOH for dekeratinization. Okay, with gentle flaming, we can see this nice picture. Okay. This is another shape or nodules. Just this is atypical, but here you can see this is thick from here, just tapered from here. Okay, this is black Piedra. How it's attached firmly, of course, to the infected hair shaft. This is, of course, magnified picture. This is multi nodules of infected hair with Piedra. Okay, now we turn to the other type of Piedra, which is white Piedra. This is characterized by what? Forming soft mucilaginous, in contrary to the previous one. If you remember, we said tough, rough, okay, but here soft mucilaginous, white, not black or brown, white, sometimes greenish yellow to light brown, sometimes nodules, which is mainly affect the hair of the genital area, sometimes beard, okay, sometimes mustache, rather than the scalps. Eyebrows, eyelashes also not involved, but put in your mind that black Piedra maybe infect the eyelashes, eyebrows, I mean the upper part of the body, hair, scalp hair, sorry, eyebrows or eyelashes. In contrary to white Piedra, the nodules here usually thick from the center This is it's thick from the center, in contrary to the previous. If you remember, we said it's thick from side opposite. It's scattered. Okay, but here it's thick in the center, but also with variation of shape and size. This is, okay, you can see here thickness from the center. This is white Piedra. This is white Piedra, white in color. Okay. This is causative agent. I mean the fungi responsible for white Piedra, which is Trichosporum bigeli, which is referred to as species because Trichosporum also have different species. This is mentioned species, but here bigeli mainly is the causative agent of this phenomenon. Unlike the nodule of black Piedra, the fungal mass of Trichosporum bigeli can be easily pulled off. You remember we said it's soft mucilaginous, therefore it can be easily pulled off of the infected hair shaft, in contrary to the black Piedra, which is firmly attached to the hair shaft. The initial growth of this fungi starts beneath the cuticle of the hair shaft, in contrary to the previous one. The hair, of course, at the point of attachment of the nodules is mainly weakened and broken easily. This is another picture reveal another, of course, this is more magnified one. White Piedra, how it's attached, not firmly, not surrounded. Okay, black Piedra surround the hair shaft. It's not surrounded. Okay, therefore it's easily pulled out the infected hair shaft. This is white Piedra also infected the hair shaft. Okay. Now we turn to the third disease of fungi, which is the disease referred to as Tinea nigra from the name. Nigra means blackish. Later on, of course, you know what is the details of the disease, which is also referred to as nigricans palmaris or pityriasis nigra. Okay, these are the synonym of the disease. Tinea nigra is a superficial asymptomatic fungal infection of the epidermis. This is the definition of Tinea nigra. It is superficial, asymptomatic fungal infection of the epidermis, which is characterized by forming brown to black, mainly black, therefore the name. Forming brown to black macules, also its macule look like Malassezia, macules, that mean large spots, with well-defined border lines. This is the definition of the disease. The lesions mainly occurred where? Mainly in the palms of the hands. Therefore, the name nigricans palmaris. Therefore, because it's infected the palm of hands mainly. Therefore, the name, and less frequently maybe infect the sole of foot also, or other area may be involved. The causative agent, just one causative agent responsible for the disease, is referred to as Ixophiala wernickeii. Ixophiala wernickeii, okay? This is the causative agent responsible of the disease. Now, clinical manifestations. Tinea nigra usually presents as also asymptomatic here, almost superficial fungal diseases, mainly asymptomatic. Therefore, it's neglected by the patient. Therefore, it's complicated further with the progression of the time. It's asymptomatic, dark patch of the skin, as we mentioned in the previous slide. On the patch, as a dark patch on the skin of palm of one hand, sometimes both hands, but it's rarely both hands. The other location, also solar food, interdigital webs of the hand, sometimes in the interdigital webs of the hand, sometimes the also a palmar aspects of the hand, sometimes the wrist, forearm, trunk, neck, wherever. Okay, the lesion usually single with irregular, sharply defined margins. This is the typical lesion. Okay, now as you see, this is maybe not clear enough. Okay, this is macule of hyperpigmented lesion. This is Tinea nigra of one patient developing this phenomena. This is, as you see here, both hands infected. This is both hands infected, developed Tinea nigra, both hands. Okay, this is another Tinea nigra in the foot, sole of foot of one patient. This is the causative agent. Okay. This is the conidia form of the just look like yeast. Okay, this microorganism, put in your mind, this is dimorphic. That it's look like here yeast. And in other picture look like hyphae outside, I mean outside the body. This is the picture of outside, this is inside the body. Okay, it's dimorphic. Now we turn to the fourth important, very important disease, which is the mucormycosis. This is very important disease, okay, and mainly cause cutaneous but systemic, also considered to be actually the most important symptoms, and it's so important because it's danger and fatal. Mucormycosis. Let us know what is mucormycosis. The agent of mucormycosis are ubiquitous. What's the meaning of ubiquitous? That means it's found everywhere. Okay. Mucor. That means أكل الخبز. Well, أكل الخبز. This is mucormycosis is the disease. Mucor the cause of the agent. Later, also, of course, not mucor. Mucormycosis caused by different entities. Okay. Now, it's considered to be thermotolerant organism. That means it can tolerate high temperature and grow on decaying materials. And any spoiled, decaying vegetables with materials, it can be grow on easily. The members of, this is definition, you remember this, the members of Mucorales, this is the order of the kingdom. Mucorales cause both localized and disseminated. That means localized and superficial, and disseminated from blood to every organ, may be occurred, and particularly in immune-compromised patients. Only rare case reports of invasive mucormycosis in apparently normal hosts. Invasive in immune competent one, rare cases, but there are cases registered, okay, of this phenomena. And although local cutaneous infection may be occurred in all patients, immune competent and immune compromised. Okay, local, and I mean localized, superficial, cutaneous, which later on we will know the cutaneous one. Cutaneous, it's infect both immune compromised and immune competent, of course, individual. But invasive one rarely infect immune competent, but mainly infect immune compromised patients. There is another type of disease, maybe caused by mucorales, which is allergic pulmonary disease. Look like this caused by aspergillus, if you remember, which is caused in the previous lecture. We said ABPA, allergic bronchopulmonary aspergillosis. Okay, this is also causing allergic pulmonary disease, which is mainly occurred in immune competent hosts, and it reflects acute hypersensitivity due to the immune response rather than the invasive disease. Okay, yeah, that means the intensity of the disease comes from the severe hypersensitivity rather than the invasion. Mucormycosis is common in immune-compromised patients, as we mentioned, and particularly DM patients. Diabetic patients mainly develop, this is very important, mainly develop this phenomenon. And there has been, of course, alarming rise in the incidence of mucormycosis at major transplant centers. Also, those patients who underwent bone marrow, kidney transplantation, whatever, because of course they undergo treatment, immune suppressive, they have corticosteroid suppressive regimen of treatment. Of course, they easily acquire the disease, particularly if they are, of course, admitted in the hospitals. And this microorganism, as we said, is ubiquitous, and it's here, it's air contaminant, maybe from contamination, the tools, whatever, the patient may acquire the agent causing this, the mucormycosis, whatever the type of mucormycosis, particularly, of course, the invasive one. The major risk factors of mucormycosis include what? Uncontrolled diabetes mellitus. Those patients with DM which are uncontrolled one, then they are mainly develop this phenomenon. I mean mucormycosis, and other forms of metabolic acidosis. Also, treatment with of course, those patients, any patient suffering from metabolic acidosis, those who undergo treatment with corticosteroids, especially in patients who have received organ or transplantation, as mentioned above. Also, those who exposed to trauma, burns, have a malignant hematological disorders, or have received deferoxamine. Deferoxamine therapy, this is a very important drug of choice. Deferoxamine mainly given to those patients with thalassemia because they have iron overload. Deferoxamine mainly considered to be chelating agent, iron chelating agent. And when this mucor enter the bloodstream, okay, it is when found this deferoxamine, because deferoxamine chelate iron and mucorales to iron, we can see deferoxamine high level mucormycosis occurred in such patients, okay, because the overload of iron and its chelating agent for its go. And in addition, deferoxamine, not this is the just the fact. Deferoxamine also at the same time interact with or interfere with the anti fungal activity of this serum. Therefore, of course, serum consists of blood in particular, and when there is cytokines, whatever, which is triggered against fungi load activity of serum, of course, due to deferoxamine, the invasion of this agent is easily causing the systemic complications. Now, concerning clinical manifestations of mucormycosis, here the first important common disease. If you remember, mainly when I categorize the diseases, I start with the most important one, the rhinocerebral mucormycosis. Rhinocerebral mucormycosis, which is the most common disease, present between the 1/3 to 1/2 of all cases. يعني third to half of all mucormycosis, this rhinocerebral mucormycosis is responsible for this only. يعني half the cases or third the cases belong or stick to rhinocerebral mucormycosis. Approximately 70% of cases with rhinocerebral, which is referred to as also craniofacial mucormycosis, found in diabetic patients with ketoacidosis. You can see here this patients, of course, later on we will know why this is blackish in color. Of course, these patients suffering from rhinocerebral reach the orbital area. Okay, of course, because it's disseminated easily, because it's forming hyphae. Hyphae easily disseminated through blood vessels. Look like aspergillus. If you remember, I said it's why it's causes ischemia. Also here, the same blackish color ischemia. Okay, because the hyphae plug the blood vessels, causing the ischemia. This is another picture of 45 years old woman with poorly controlled diabetes mellitus with facial and periorbital swelling. Okay, due to zygomycosis. Zygomycosis, it's zygomycetes, it's a type of mucormycosis. The same. She was unable to open her right eye, of course, upon admission. This is aggressive rhinocerebral mucormycosis. This is the aggressive one. So why it's aggressive? Because infection بالبداية طبعا occur in the beginning, infection, then ischemia, then sloughing. Later on, we will know. You found this patient lost his eyes and even nose. Okay. The rhinocerebral mucormycosis is increasingly being encountered in patients receiving, of course, where we can see this phenomena, in addition to the diabetic with uncontrolled diabetic, of course, those who are receiving high doses of corticosteroids, such as those with rheumatological disorders or who have receiving organ transplant. The initial presentation is often consistent with sinusitis. The first symptoms that the patient is suffering from is sinusitis. Okay, sinusitis, including facial pain, unilateral headache, unilateral, not bilateral, unilateral headache, proptosis, then later, of course, within the time, proptosis, يعني العين تشحط, proptosis, then associated with soft tissue swelling. Fever here is frequently occurred. Okay. Now, pulmonary mucormycosis, okay? Pulmonary mucormycosis. This is the second type of diseases, or the second disease caused by or zygomyces, whatever, okay? Pulmonary mucormycosis occurs mainly in patients with profound or
بسم الله الرحمن الرحيم إن الله وملائكته يصلون على
leukemia mainly. Leukemic patients mainly develop pulmonary mucormycosis, okay? Or those who are recipients of hematopoietic stem cell transplantation also may develop pulmonary mucormycosis. Patients with DM, of course, with ketoacidosis also can develop this phenomenon. Pulmonary mucormycosis may develop as a result of inhalation. How it's come? From inhalation of these pores of mucus. It's moldy form causing hyphae, and the spores. It's monomorphic, not dimorphic. So resemble aspergillus, okay, and it comes from inhalation of the spores of this fungi, or sometimes by hematogenous dissemination, or sometimes by lymphatic spreading, okay. Three measures or three ways of occurring of this phenomena in pulmonary mucormycosis, either by inhalation or hematogenous, or by lymphatic spreading. You can see here, this is CT scan of patients with mass. You can see this mass of in the left lobe of the lung, which show the mass of fungi. And of course, this is a biopsy of this lung, show the hyphae. These are the hyphae within the tissue of the lung. These are the hyphae. These are the hyphae of the fungi. This is also a picture, okay. This is the in the lower lobe, okay. You can see this is the mass of chest X-ray. You can see this patchy infiltrate, okay, due to the infection of this agent. Symptoms here include what? Symptoms, I mean, sorry. Symptoms of pulmonary, mucormycosis include fever, dyspnea, cough. Of course, angioinvasion results in tissue necrosis. You remember I said the hyphae can plug the blood vessels because these hyphae invade the blood vessels, causing necrosis, tissue necrosis associated with hemoptysis. This is the role of, and because this angioinvasion causing hemoptysis, which may, of course, fatal if a large blood vessels are involved, of course. Here we have the third type of mucormycosis, which is cutaneous mucormycosis. Still nobody here? Nobody here? Anyhow, طلاب ماكو أحد؟ ما حد حاضر؟
نعم دكتورة موجودين.
شو كنت جيتوا هسه بالأخير؟
لا موجودين دكتور، بس دكتور عندنا امتحان اورال، احنا يعني الجروبات كلها ما موجودة
بس
حاليا.
هذا
باتل.
شلون يمتحنوكم؟ منو امتحنكم؟ منو امتحنكم قول لي؟
دكتور هو باتل، الدكاترة كلهم يعني امتحان اورال كل مرحلة.
اسمح لي ماما،
القاسمين.
اسمح لي ماما. اوكي
تفضل دكتورة.
امتحان بس اريد افتهم بس الانفورميشن اعطيني اياها. شو وقت امتحنوكم الباثو؟
هسه جروبات قسمونا، مجموعة يعني
الله.
مجموعة هسه ومجموعة بالتسعة، اكو مجموعتين هيك وقت يعني كل جروب وقت.
اعرف starting from which hour؟ يعني انا اريد اعرف شو وقت
8
ب8 يعني تعدوا على محاضرتي، ولذلك انا حاشتكي عليهم وخلي يصبروا لي جماعه الباثو، زين؟ لان هذا تصرف لا اخلاقي. يعرفون عندكم محاضرات، احنا بعدنا ما خلصنا الكورس، شلون ينطوكم ب8 وانتم شلون تقبلون؟ anyhow انا اعرف شلون حصرف على جماعه اسوي شكوى عليهم. هو يا جماعه دكتور بسام وبسيطه اني لهم، هم كلهم جماعه ديسترب بسيطه. anyhow مع احترامي طبعا للجيدين، مع احترامي للجيدين اكيد طبعا، بس اللي سووها طبعا انا هم التقصير، مو بس هذا التقصير من الممثل المرحله. anyhow كوتينيوس ينتظرون تخلص المحاضره ب9 طاير، هم امني انتم مداومين، انتم بالبيت قاعدين عسى لليل تبقون. صح دا احكي لو مو اني مقصره؟ ابني تسمعني مرتضى؟
ها دكتورة لا حيدر.
العفو مو هني ما اعرفكم يعني ما ادري اشوفكم. حيدر ماما يعني دا احكي خطا يعني ما يقدرون يمتحنوكم بالتسعه وقتكم هذا شلون يتعدون على محاضره؟
دكتورة هم ما امتحنوا كل الجروبات يعني اتوقع بس 20 شخص هسه داخلين هم بالامتحان، احنا امتحاننا بالتسعة احنا جروبنا.
ما يخالف عسى حتى لو ما يحضرون بس هذا احترام، هذا وقت محاضرتي ما يصير يتعدون يقبلونهم احنا نتعدى عليهم.
لا دكتورة متوقعوا انه كملنا يعني اغلب المحاضرات احنا كملناها
ابني
يعني ما تبلغوا الدكاترة انه
كملتوا
كملنا.
بعدكم ايش قد؟ بعدكم ورايا 3-4 محاضرات 3 محاضرات شلون كملتوا؟ وزين على كل حال انا اتصرف أنا أتصرف بعدين. المهم عندنا cutaneous mucormycosis is the other type which is that's mean infection of course the skin which is occur following traumatic implantation. That means the patient or individual exposed to trauma and when the source of trauma contaminated with the agent, of course there is implantation from soil, for example, from the source itself of traumatic substance, maybe causing the symptoms. But they found that the most common entity of patients who develop cutaneous mucormycosis are those who exposed to motor vehicle accidents. Okay, why motor vehicles, not car? Also, of course, sorry. For example, accident because motor vehicles, you know, it's exposed vehicle. When there is accidents and the patients maybe go out on the earth, okay, of course he exposed to trauma, wound, injury, he contact to the earth, okay, to the earth, paved earth, to the plant, to the soil, for example, and the microorganism found on this area. When there is wound, there is implantation of the causative agent causing cutaneous manifestations. Of course, diabetic patients, immune compromised patients, of course, may develop cutaneous lesions, and mainly those patients arise this phenomena at the site of insulin injection. Diabetic patients develop this phenomena in the site of insulin injection or catheter insertion site, mainly. Contamination maybe the needle contaminated, the catheter contaminated, insertion site causing the cutaneous mucormycosis. Primary infection produce acute inflammatory response with purulence. This is very important symptoms. Okay, acute inflammatory response with purulence, abscess formation, tissue swelling, necrosis also. Okay, and this is very important symptoms that the patient develop. The lesions may appear red and indurated. The lesion appeared red and indurated and often progress to black e-scars. What's the meaning of black e-scars? E-scars, that means scars, okay? It's turned to blackish in color. Why is from red induration to blackish in color? Black because necrosis. You remember I said it's caused necrosis, tissue necrosis, pluggage of the blood vessels causing the black e-scars. The necrotic tissues may slough and produce large ulcers. The necrotic tissues sloughing, producing large ulcers within the time. After scar sloughing, you remember the picture of the patient who lost his nose and eye due to the sloughing. This is, as you see, it's violet in color, blackish, in particularly this area. This is the site of insulin in patients with the vindicator sites, of course, okay, developing cutaneous mucormycosis. This patient, of course, may be having maybe diabetic, and at the site of insertion of the insulin, he developed this phenomenon. Of course, he may be not interested with the hygienic conditions causing this one. This you can see this big large area of cutaneous mucormycosis. This is sloughed after blackish, after e-scar, black e-scar. It's maybe slough. This is the most important These are the most important symptoms of cutaneous mucormycosis. The other disease which caused by mucor or zygomycetes in general is the gastrointestinal mucormycosis. Gastrointestinal mucormycosis, which is mainly, of course, affect the gastrointestinal tract. Although it is rare, but it's so very important phenomenon. It's mainly encountered in nosocomial setting in hospitals, for examples, and it's mainly arise from ingestion of the fungi. Ingestion of the spores of fungi may causing this phenomenon. What are the symptoms the patient develop? Of course, abdominal pain of intestinal due to intestinal obstruction, such as distension of the abdomen, nausea, vomiting. These are the most important symptoms. Of course, fever sometimes associated with or accompany the disease with hematochezia. What's the meaning of hematochezia? It means bloody stool, hematochezia. These are the most important symptoms of the patient suffering from gastrointestinal mucormycosis. You can see this a bit large intestine and blackish color. This blackish color, you can see differentiate between this is the stool, this is blackish color, gangrenous effect due to the intestinal mucormycosis. Okay, you can see here how it is so dangerous disease. Disseminated mucormycosis, of course, can be disseminated easily through blood vessels, bloodstream, and causing the other symptoms. The microorganism easily incede brain. Sometimes it's also disseminated to other organs, especially spleen, heart, skin, and any part of the body may be involved or it may be inceded by this agent. Patients may be present with an insidious onset of what? Neurologic symptoms. Those patients with CNS infection, of course, when the blood consists of the spores incede the CNS, causing insidious onset of neurologic symptoms with more sudden development of focal neurologic deficits, altered mental status. Also, sometimes the patient develop coma. The mortality rate here in those entity of patients who developing CNS manifestations reach 100%, because it's so dangerous and it's considered to be the last sequel of events. Therefore, it's 100% of patients developing this phenomenon will be died. The last disease we have it now or today is what is called coccidioidomycosis, which is also referred to as valley fever or desert rheumatism or California disease. California because it is common in California or endemic in California and valley area in particular, and later on we will know why it's referred to as desert rheumatism. Of course, the disease coccidioidomycosis is infection caused by the agent Coccidioides immitis, just one genus, but we have two species. Okay, Coccidioides immitis and Posidacea. We have two species. I just chose only the immitis, Coccidioides immitis. The disease usually acquired due to the inhalation of the conidia or the spores formed by the agent. The characteristic feature of the conidia or spores of this fungi, it's articulated. Okay, therefore it's referred to as arthroconidia. This is the definition of this the disease. The most symptoms of the or symptomatic patients have only just mild, sometimes just moderate flu-like symptoms. Okay, sometimes resolve spontaneously even without a treatment. But small proportion of patients develop potentially lethal progression of infection, either within the lung or hematogenous dissemination. Sometimes acute pneumonia, sometimes hematogenously disseminated and inceding other organs. Now, clinical manifestations, starting with the primary coccidioidomycosis. We have different diseases. What is the primary coccidioidomycosis? Primary, I speak about the pulmonary. It means primary pulmonary onset of symptoms usually after 10 to 17 and sometimes range 7 to 28 days after the acquisition of the spores of the agent. The patient may develop the symptoms. The most common symptoms are what? fever, which is accompanied with pleuritic or dull chest pain. Of course, cough with some degrees, maybe presence, maybe either dry, sometimes productive. We have different types. It is not specific symptoms, okay? Either dry, sometimes productive, okay? If it is productive, what is the discharge? The smelly, whitish, purulent, sometimes bloody, streaked sputum. Now, more dramatic, with more dramatic accompanied symptoms, which is associated with this pulmonary symptoms. There is a rash maybe appear with which is mainly erythematous rash, we have two types of rash, which is erythematous, either nodosum or multiform. We have erythema nodosum or erythema multiform. We have two types of rash, erythema nodosum or erythema multiform. These cutaneous manifestations appear at any time from several days to 3 weeks after the onset of respiratory symptoms. Okay, these cutaneous manifestations appear at any time from after 3 weeks after the onset of what? Of the pulmonary, after 3 weeks, days, several days, or 3 weeks after the onset of the pulmonary symptoms. In a third of cases, the disease accompanied by what? In addition to these symptoms, third of patients, sometimes without these erythema, sometimes pulmonary just with the other symptoms, which is third of cases may develop arthralgia, which is involved one or more joints, and particularly the ankle or knees. This is erythema nodosum. Erythema nodosum. This is a type of lesion accompanied pulmonary symptoms. The symptoms, I mean, when the patient develops arthralgia, given the arise the old name, which is referred to as desert rheumatism, because the first case occurred in California in desert area. Therefore, it's referred to as desert rheumatism. Many cases of coccidioidal pneumonia resolve sometimes spontaneously without treatment, but this resolution forming a dense spherical nodule in the area of infiltrate. Where there is infiltrate, there is, of course, when there is a resolution without treatment, we can see formation of dense spherical nodules, okay, in the area of infiltration. Although such nodules are benign, concerning that a solitary nodule may be cancerous. Solitary, if it is multiple, are benign. But if it is solitary, يعني مفردة, it's cancerous. Some patient underwent unnecessary thoracotomy, but it's still cancerous one. Now, the disseminated coccidioidomycosis, it's most frequently, of course, due to the dissemination of the microorganism through bloodstream. Dissemination is more likely to occur mainly. There are predisposing factors for disseminated coccidioidomycosis, or racial factor play a role. Negroes have a propensity to develop this phenomena, I mean disseminated coccidioidomycosis. Filipinos also, or immune compromised patients, of course, this is a fact, not need discussion. Dissemination is more indolent in onset, heralded by the appearance of skin lesions. That means dissemination may be inciting skin, causing cutaneous lesions, subcutaneous abscesses sometimes, osteomyelitis, bone lesions, sometimes even chronic meningitis due to blood hematogenous dissemination. Is there anybody here or not disappeared? طلاب سمعتوا ولا لا؟ أكو أحد؟
بلي دكتور بلي موجود.
Okay. This is the last lecture. وبالمناسبة طبعا هاي هم دروباك على